Is the official NCLEX practice exam harder than the real test? Question 1. The nurse is speaking at a community meeting about personal responsibility for health promotion. A participant asks about chiropractic treatment for illness. What should be the focus of the nurse's response? Option A, electrical energy fields. Option B, spinal column manipulation. Option C, a mind-body balance. Option D, exercise of joints. The correct answer is option B, spinal column manipulation. Chiropractic medicine is founded on the principle that physiological function is heavily influenced by spinal alignment and manipulation. Question 2. Which of these findings indicate that a pump to deliver a basal rate of 10 milliliters per hour plus as needed for pain breakthrough for a morphine drip is not working? Option A. The client complains of discomfort at the intravenous insertion site. Option B. The client states I just cannot get relief from my pain. Option C. The level of the drug is 100 milliliters at 0,800 and is 80 milliliters at 1200. Option D. The level of the drug is 100 milliliters at 0,800 and is 50 milliliters at 1200. The correct answer is option C. The level of the drug is 100 milliliters at 0,800 and is 80 milliliters at 1200. At 10 milliliters per hour, 40 milliliters should be gone in 4 hours just from the basal rate alone. A drop of only 20 milliliters indicates the pump is not delivering the minimum required dose. Question 3. When teaching a client with coronary artery disease about nutrition, the nurse should emphasize: Option A, eating 3 balanced meals a day. Option B, adding complex carbohydrates. Option C, avoiding very heavy meals. Option D, limiting sodium to 7 grams per day. The correct answer is option C, avoiding very heavy meals. Heavy meals shunt a massive amount of blood to the gastrointestinal tract for digestion, which decreases coronary blood flow and can trigger angina. Question 4. A registered nurse who usually works in a spinal rehabilitation unit is floated to the emergency department. Which of these clients should the charge nurse assign to this nurse? Option A. A middle-aged client who says I took too many diet pills and my heart is racing. Option B. A young adult with alcohol withdrawal symptoms experiencing limb jerking. Option C. An adolescent on pain medications for terminal cancer with stable vitals and pupils equal and reactive. Option D. An elderly client who reports having taken a large crack hit 10 minutes prior. The correct answer is option C. An adolescent on pain medications for terminal cancer with stable vitals and pupils equal and reactive. Floating nurses should be assigned the most stable, predictable patients. The adolescent with stable vitals on chronic pain management is the most appropriate. Question 5. A client comes to the clinic for treatment of recurrent pelvic inflammatory disease. The nurse recognizes that this condition most frequently follows which type of infection? Option A, trichomoniasis. Option B, chlamydia. Option C, staphylococcus. Option D, streptococcus. The correct answer is option B, chlamydia. Untreated chlamydial and gonococcal infections are the most common bacterial precursors to pelvic inflammatory disease. Question 6. A client is receiving digoxin 0.25 milligrams daily. The healthcare provider has written a new order to give metoprolol 25 milligrams twice a day. In assessing the client prior to administering the medications, which of the following should the nurse report immediately? Option A, blood pressure 94/60. Option B, heart rate 76. Option C, urine output 50 milliliters per hour. Option D, respiratory rate 16. The correct answer is option A, blood pressure 94/60. Metoprolol is a beta blocker that will further lower blood pressure. A starting systolic pressure of 94 is critically low and should be reported. Question 7. A nurse enters a client's room to discover that the client has no pulse or respirations. After calling for help, the first action the nurse should take is: Option A, start a peripheral intravenous line. Option B, initiate high-quality chest compressions. Option C, establish an airway. Option D, obtain the crash cart. The correct answer is option B, initiate high-quality chest compressions. Current basic life support guidelines prioritize circulation, chest compressions, first in the CAB sequence for a pulseless patient. Question 8. The nurse prepares the client for insertion of a pulmonary artery catheter. The nurse teaches the client that the catheter will be inserted to provide information about: Option A, stroke volume. Option B, cardiac output. Option C, venous pressure. Option D, left ventricular functioning. The correct answer is option D, left ventricular functioning. A Swan-Ganz catheter measures pulmonary artery wedge pressure, which is an indirect but highly accurate indicator of left ventricular function. Question 9. During an assessment of a client with cardiomyopathy, the nurse finds that the systolic blood pressure has decreased from 145 to 110 millimeters of mercury, the heart rate has risen from 72 to 96 beats per minute, and the client complains of periodic dizzy spells. The nurse instructs the client to: Option A, increase fluids that are high in protein. Option B, restrict fluids. Option C, force fluids and reassess blood pressure. Option D, limit fluids to non-caffeine beverages. The correct answer is option C, force fluids and reassess blood pressure. A drop in blood pressure accompanied by a compensatory rise in heart rate and dizziness indicates hypovolemia. Forcing fluids will help restore volume. Question 10. The nurse anticipates that for a family who practices traditional Chinese medicine, the priority goal would be to: Option A, achieve harmony. Option B, maintain a balance of energy. Option C, respect life. Option D, restore yin and yang. The correct answer is option D, restore yin and yang. Traditional Chinese medicine is fundamentally based on restoring and maintaining the balance between the opposing forces of yin and yang. Question 11. A nurse prepares to care for a 4-year-old newly admitted for rhabdomyosarcoma. The nurse should alert the staff to pay more attention to the function of which area of the body? Option A, all striated muscle. Option B, the cerebellum. Option C, the kidneys. Option D, the leg bones. The correct answer is option A, all striated muscle. Rhabdomyosarcoma is a highly malignant tumor that originates in striated, skeletal, muscle tissue. Question 12. The nurse is caring for a client with a serum potassium level of 3.5 milliequivalents per liter. The client receives 40 milliequivalents potassium chloride in 1,000 milliliters of 5% dextrose. Which electrocardiogram pattern indicates the infusion should be discontinued? Option A, narrowed QRS complex. Option B, shortened PR interval. Option C, tall peaked T waves. Option D, prominent U waves. The correct answer is option C, tall peaked T waves. Tall, peaked T waves are a hallmark sign of hyperkalemia, indicating that the potassium infusion has pushed serum levels dangerously high. Question 13. The nurse is preparing to administer an enteral feeding to a client via a nasogastric feeding tube. The most important action of the nurse is: Option A, verify correct placement of the tube. Option B, check that the feeding solution matches the dietary order. Option C, aspirate abdominal contents to determine the amount of last feeding remaining. Option D, ensure that the feeding solution is at room temperature. The correct answer is option A, verify correct placement of the tube. Verifying tube placement prevents the fatal complication of administering feeding solutions directly into the lungs. Question 14. While planning care for a toddler, The nurse teaches the parents about the expected developmental changes for this age. Which statement by the mother shows that she understands the child's developmental needs? Option A. I want to protect my child from any falls. Option B. I will set limits on exploring the house. Option C. I understand the need to use their new skills. Option D. I intend to keep control over our child. The correct answer is option C. I understand the need to use their new skills. According to Erickson, toddlers are in the autonomy versus shame and doubt stage, requiring opportunities to practice their newly developed skills independently. Question 15. A triage nurse has 4 clients arrive in the emergency department within 15 minutes. Which client should the triage nurse send back to be seen first? Option A. A 2-month-old infant with a history of rolling off the bed and bulging fontanelles. Option B. A teenager who got a singed beard while camping. Option C. An elderly client with frequent liquid brown-colored stools. Option D. A middle-aged client with intermittent pain behind the right scapula. The correct answer is option B. A teenager who got a singed beard while camping. A singed beard strongly suggests inhalation injury. The airway can swell and occlude completely within minutes, making this a life-threatening priority.